Congratulations. You're receiving this because you have expressed interest or you are possibly going ahead with Morpheus8. So I want to give you a little background on Morpheus8. They perform Morpheus8 around the world 8 times every single minute. It is ongoing and it is one of the fastest growing skin tightening mechanisms on the market. So you get to participate in that, and so it's going to be a fun ride. But I want to go through some of the things that you will need to know prior to and on the day of your actual treatment, plus what to do afterwards. Before you arrive, how can you make sure that you are optimized for it? What I'll tell you is there's not much that you need to do. You don't have to come prepared. You don't have to take anything prior to. Some people, if you do notice that you bruise easily, some people do like to take arnica just because that can reduce your bruise, the amount that you may bruise. Secondarily, if you do take any blood thinners, we need to have that discussion before you come in because you may be advised to take those off, but I am not going to advise you without a discussion with you and your provider who is prescribing those. So those are the 2 main things that I would want to discuss prior to you actually starting the treatment, so just keep those in mind. One more thing that I think is important is there are some minor contraindications that we can't do it, like if you have a pacemaker. There are some others, but it's going to be something that we're going to discuss in office before you do the treatment. So just prior to the treatment, I want you to make sure you stop the retinol at least a week beforehand so that way your skin has healed up as much as possible before we start to do the damage that Morpheus is going to cause from a needling standpoint. So that being said, let's walk you through the day of. So you walk into the office, you're greeted by my amazing staff, and then they say, okay, let's get you into a gown. The reason that they're going to get you into a gown is because we're going to put a numbing agent on you. That numbing agent has a little bit of a petroleum type base, and I don't want to get it on your clothes. You'll sit with that for anywhere from 10 minutes to 45 minutes, depending on the area that we're going to do, and they're going to have you get nice and comfortable while they do it. You may also notice that you're going to feel like you're on the red carpet because the paparazzi are going to show up. We're going to take lots of pictures to make sure that we know where you're starting from and where you're progressing to. Not just because we want you to take our word for the fact that you're improving, but we want you to be able to see that difference from before and after. So we'll take lots of pictures. So you'll sit for about 10 to 45 minutes with that numbing agent on, get you really good and numb. Then we'll take you into the procedure room. In that procedure room, depending on what specific area, we may do a little extra numbing. We'll use what's called a mesoram. So we'll just introduce some needles and numb you a little bit more deep, just so that way, I don't want you to feel anything. I want you to be very, very comfortable during this procedure. So that's why we'll use a little bit extra lidocaine, injectable lidocaine to make it more comfortable for you. So we'll take off all the numbing, we'll get you that extra numbing, and then we'll start the procedure. For each procedure, everybody's a little bit different depending on the area. Some people will take about 30 minutes, some people will take about an hour and 15 minutes, but that's kind of the general timeline. I have you in the office for about 2 hours to 2.5 hours, just to make sure that we get a very, very thorough treatment. After the treatment, I will put on some post-procedure repair complex that is specifically going to be growth factors so that way you get that healing started as soon as possible. I want those growth factors to really kick in so that way it develops the collagen, the fibroblasts, and tightens the skin just like you're wanting it. Now, if you are wanting some extra submandibular fat or some areas that you're wanting fat melted, I will boost your energy just a little bit. So just be prepared. You may be a little red and swollen after the actual treatment. That's very normal, but I always recommend that if you do have any questions that I want you to call me so that way we can make sure that everything is normal. We do more of these than anybody just about in the country. So I will have seen most of the things that can go right or go wrong, but I want you to give me that opportunity to tell you if that's the right thing or the wrong thing. And sometimes I may have you come into the office and check, but we want to make sure that you're getting the best possible treatment in our office. That's our goal. So what does it look like when you leave? You may be a little bit red and swollen depending on the area that you do, and that's perfectly normal. I'm going to provide you with a skincare when you leave, but I want you to make sure the 2 rules that I have are you keep it clean and keep it moist. So using an antibacterial soap or something like that, or a very gentle cleanser to make sure it stays clean. Plus, if you can add on a growth factor to it just to make it stimulate that collagen development, that'll help a ton. A lot of my patients complain of itching after the fact, usually days 2, 3, and 4, where they get a little bit itchy and scratchy. And what that is that's the histamine response. So as your body's healing up, you're gonna get that to where you feel very dry and flaky. I do provide for some of the treatments, or I have in office some of the things that'll help with that to make it a little bit more tolerable, but most of my patients tolerate it very, very well. What to expect from a healing standpoint? Depending on how many treatments you've done, your age, how aggressive we are, etc., Anywhere from 3 to 5 days is very typical. But if I go very, very aggressive, somewhere around 7 days can be the most extensive of all of that. What you can expect from a healing standpoint, typically I would tell people that you'll be a little bit red and swollen for about 3 to 5 days. Depending on how aggressive we go, depending on your age, depending on what our goal is, you may be a little bit more red and swollen up to 7 days, but that's typically the max that I see with most of my patients. I do these treatments in a series of 3, and I give you about 6 weeks in between each one. The reason why, I want you to heal up completely, and then we do it again. And what that's doing is it's teaching your body to heal. Now, if you remember when you were a kid, you would scrape your knee, and by the time you got home, it was almost healed all the way. Versus now, you may scrape your knee, and it takes you a few days. And if you're 80, it may take you weeks to heal. Well, what happens is your body slowly loses its ability to vascularize. In other words, it slowly loses that blood flow. That's what evolves, or that's what makes it so that you don't develop the collagen like you used to. So when we cause that injury from the needles, what's going to happen is your body learns to heal all over again. The more times we do it, the more you heal. Which brings me to the point of most of my patients, I recommend every 6 to 12 months, you just do a touch-up, a maintenance. It's kind of like your yearly protect your investment. And the reason why I want you to do that is because I want it to constantly be improving. It doesn't matter if you're 30 or you're 80 when you're doing this. It's all about keeping that reproducing skin cells, reproducing collagen, reproducing and reintroducing that vascularization, that blood flow. That's the whole goal. So if you do Morpheus on your face, I will give you a skincare bundle that you go home with. It's got everything you need to know because I don't want you doing anything that's not something that I gave you. The reason why, I had a lot of patients when we first started out, they would just put on whatever. And then they would call me and say, something's going wrong. The reason why is because they were putting things on that would make it more swollen, more red, and exacerbate the process. So I don't want you to do that. I'm gonna give you a whole skincare bundle so that way when you go home, you know exactly what you're supposed to do morning and night. If you're doing a peripheral, so like an abdomen, leg, something like that, I'm gonna give you a different product just to help you heal, but it won't be as extensive as perhaps the face, just from the standpoint that you don't take care of your face and the rest of your body the same way. Now, if you are doing Morpheus and you feel like, okay, I'm a little bit nervous, I do have Pronox in office so that way if you feel like I just need something to take the edge off, totally doable. And it's something that is very, very light. You don't even need a ride to go home with it because it'll just make it so that you're like, okay, this is a little bit easier to tolerate. You'll come in that every 6 weeks as we do those, and we will do the same process to take the pictures so that I can show you the progression. You will be able to start your regular skincare 1 week after. So you live in that box of skincare for the week. 1 week after, you can resume your normal skincare. Or if you do have questions about skincare, please don't hesitate. We'll be together for about an hour doing the treatment, so you'll have time to talk to me about what potential skincare you can do that will enhance and improve your Morpheus results. But that's the best way that I can tell you would be Morpheus, and that's your timeline. But I look forward to taking care of you and seeing how we can help you feel better. So you may hear us refer in our office to a bright and tight kind of package. It's pretty common that we like to pair things in our office. And the best reason I can tell you is because we want your results to be absolutely phenomenal. So what is a bright and tight package? What that is we will pair Morpheus, the 3 treatments of Morpheus, with an IPL. It may be a series of IPLs, it may be a single IPL, but what that is IPL is intense pulse light. And what that does is it finds the hyperpigmentation or the discolorations in your skin and pulls them out. So that way, I always tell people, I want your tone and your texture to improve. And what IPL does is it helps your tone to improve, not just your texture. Where Morpheus is focusing on the inconsistencies in your texture, IPL is gonna help with the dark and stuff like that. So that's what we're looking for with that. Now, when it comes to if you're doing body tight or something like that, where you're doing a little bit more quantum, a little bit more liposuction, the last step of that process is going to be Morpheus, as a matter of fact. So I'm going to come over the top of that. What I tell people is Liz works from the inside out, I work from the outside in. So I'm going to come from the outside and help the structure of your skin, the collagen of your skin on the outside really, really tighten up. And that's the goal, how we pair things in our office, not just because we need to, but because we want your results to be that much better.